So, a word of welcome. My name is Reverend Michelle Bodel, and I serve as the chair of the Board of Health and Pensions for the annual conference. And I will say that it has been a year of discernment for the annual conference around a bunch of different areas, but especially about how we be good stewards for our local churches, many of whom saw an increase this past year, even though we were having the same bottom line for our CFNA budget in their shares. And they saw that increase as we talked to CFNA, as the Board of Pension, and as others, because we have fewer churches that can contribute to that, as we are closing churches or churches merged together. And then also knowing that there's a burden within the local church. Some have come back and said, we can't really afford this because they're having fewer people contributing to their church's shares, or church's budget, and then church's shares as well. But we also wanted to be good stewards for you as retirees. We want to be able to honor the fact that this is a benefit that different conferences do different things with. But we made this transition to via benefits a few years ago, and you've all been receiving some type of stipend that is based off of your years of service in the form of an HRA that you can use towards medical expenses and as well towards a premium for your supplemental insurance from Medicare. And so we want to be good stewards for you as well. And so in between this rock and a hard place of trying to be a good steward for the annual conference budget and for local churches, and also want to be a good steward for our retirees, the board has been prayerfully working and diligently considering this issue for well over a year. I want you to know that none of the decisions that were made hastily. They were made over several meetings, always in an attitude of prayer, and also that they were made from a place of also listening and looking to what other annual conferences are doing as well. So we weren't walking into this uninformed, and through that plethora of options, what was discerned and what was ultimately voted on was the 20% universal deduction of the HRA amount from 2020 to 2021. And the reason that it was approached in that particular way is that a universal amount of each level would allow you to know exactly what you are going to be getting, versus saying, well, if you're at this level, we're going to adjust it X amount, or if you're at that level, you're going to adjust it Y amount. This seemed to me the more fair way for us to equitably share that burden with one another. And we do know as a board that it is a burden. We do know that this is a big change. And so, like I said, that's why we wanted to open it up to questions that you may have today. Know that I may not have all the answers today, but I will try so very hard to find answers for you in the coming days and be able to get back to you. So with that, I will turn it over to you all, and you are welcome to use that Q&A feature for any questions that you may have. Thanks, Jason. So what we receive as a credit will be cut by 20%. Is that correct? I just want to verify that I understood it or not. That is correct. So what you received as your HRA in 2020 would be cut by 20% for 2021. And at the bottom of your individual letter that you received, if you're a current retiree, that amount was clearly communicated to you. And if you have any questions about that, please reach out to myself or Jason Mackey, and we can talk through that specific figure for you with you. Oh, Marlon, I missed part of what you're saying, sir. I only see Michelle, comma. Go ahead and keep on typing. The question is, are we going to have the same options for health insurance as we had last year? Each participant, when they walk through, goes with VIA, and you select the supplemental program for Medicare that is best for you. And it's my understanding that those programs stay the same. And if your program is going to change, then you are told, so that you have the ability to go through that process again to select a new supplemental program. But I'm not aware of any changes in the coming year. Marlon asked, do we have any projections beyond 2021 at this time? Honestly, not at this time. I think we know that um, within the denomination, there's a lot that is up for discussion within local churches with COVID and the pandemic. There's a lot up for discussion. And so we as a board have been committed to come back to the table and talk about the HRAs every single year anyway. But I just can't, I honestly can't speak into the future as much as I would love to be able to, and say what beyond 2021 would look like. And I know that's probably not the answer that you're looking for, but that's just honestly where we are. Oh, the question is asking, is this webinar for those who are retired? Yes, this webinar is for those who are currently retired or those that are just retired as of this past July. Jason also chipped in and asking the question if we were going to have the same supplementals, that they also do offer new plans every year, as the market provides new plans. So if you find yourself wanting to switch plans at any time, that's also a possibility. Any times, I should say, during your election period. The question is that might you at some point consider the years of service in the formula? So we did consider that. One of the options on the table would say that you would, let's say, cut X amount of service by X amount and another amount by another amount. But ultimately, we wanted to be able to be fair to everyone. That's not to say that we can't revisit what it looks like for years of service within the formula. And like I said, everything is on the table every year as we come back to discuss this. And so I will certainly take that thought back to the board. But this just seemed for calculation purposes as well to be the most equitable and the easiest for us to present to CFNA. We know how many retirees we have, and so it's pretty easy to go through and calculate that particular way. But when we start to try to narrow it down in the way that you're suggesting, things got a bit more complicated. But that doesn't mean, as I said, that we can't take that back to the board. And I thank you for that suggestion. Jason, this question is for you. It says, will there be a webinar for those who are active clergy in regard to next year's health insurance options? Jason is saying, yes, there will be. And it will be coming this fall before annual election opens up at the end of October. Jason also wanted to point out to you that we're not we're looking at plans to preserve cutting retiree benefits. So I fully understand that 20% is a hard hit for some folks. Um, but ultimately, our goal was to preserve the current retiree benefits for as long as we can preserve them. Now, that may not mean, and obviously for this year, doesn't mean it's the same amount of money that we were used to in the past, but we didn't want to just cut the benefit off. That seemed to not be a just or fair solution at this time. And so we're also looking at ways to address the longevity of that benefit. And once again, I don't have a crystal ball. I don't know how long that's going to be or what that looks like X number of years down the future with all that we are facing in our current world. But I do know that that was the heart of the board, was to preserve as the benefit itself for those of you that are currently retired. Are there any other questions that I can try to address for you this afternoon? While we're giving that one more minute, I don't want to rush any of you. I want to let you know that there is going to be another webinar that's coming up on the 30th of this month to discuss sort of the ins and outs of some of the stuff that's coming up at annual conference. It is not just about retiree benefits, it's about the whole of annual conference. But know that there will be a Q&A session during that as well. So if you have any other questions, and you are welcome to bring them on the 30th, which will be via Facebook. It has not been, it's been advertised, but not fully given a link yet. Also, if you don't want to wait that long, that's absolutely fine as well. And you are more than welcome to either contact myself or Jason Mackey, and we will try to get you a more immediate answer to any concerns that you may have. Give us one more moment to see if there's any more questions for this day. And I will look to the chat as well to see, Jason, if there's anything else that you would like to have lifted up today. Jason says no. And so I look all, once again to those of you that are retirees to see if you have any more questions for us. Yes, there are retired pastors that actually do sit on the board. The question is, in your decision making, have you talked with retired pastors? Yes. Um, so the Board of Health and Pension is comprised of both equal parts lay and clergy, and a chunk over half of those that are the clergy representatives are retired, and they had been talking to certain people. Does that mean that we talked to every retired clergy? No, we definitely did not. But where other they represented the voice of retired clergy at the table. Any others? No, and I just want to thank you for taking time out of your afternoon. I want to thank you for Those of you that have reached out and have had thoughts you've wanted to share with us, know that we are listening to what you have to say. And once again, I fully understand that this was a large transition, and know that we really do care about you at the Board of Health and Pensions. And we're trying to figure out a way to be good and just to you while also caring for those that are local churches helping to support this particular benefit at this time through shares of ministry. So I thank you all for your questions. I thank you for your cooperation. And once again, know that we are here for you to reach out to us about anything, not just this particular benefit, if you have any questions for us. Thank you so much. And I hope you all have a wonderful rest of your afternoon.